My safety topic is preventing medication errors due to look-alike, sound-alike drugs. On the National Center for Biotechnology information website, I was able to find an article called A Case of Look-alike Medication Errors. This article states, the National Coordinating Council for Medication Errors Reporting and Prevention was formed by the U.S. Food and Drug Administration to actively promote the reporting, understandings, and prevention of medication errors through the coordinated efforts of its member associations and agencies, and to focus on ways to enhance the patient's safety. It defines medication errors as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of a healthcare professional, patient, or consumer. And this is the issues identification. In a study by the FDA that evaluated reports of fatal medication errors from 1993 to 1998, the most common error involving medication was related to the improper dose, accounting for 41% of fatal medication errors. Giving the wrong drug and using the wrong route of administration each accounted for 16% of the errors. Almost half of the fatal medication errors occurred in people over the age of 60. Older people may be at a greater risk of medication errors because they often take multiple prescription medications. One of the steps taken by the U.S. FDA to curtail the medication errors included reviewing drug names to minimize confusion. The Federation launched Name Differentiation Project and issued letters to manufacturers of look-alike name pairs to voluntarily revise the visual appearance of their established names. The article states that poor handwriting, use of abbreviations, unclear verbal orders, memory lapse, and the large volume of medications currently in use are some of the risk factors for look-alike medication errors. Risk reduction strategies, which are safety strategies, may include awareness of look-alike medications, installing pop-up alerts in computer systems, prescribing medications by the generic names, placing eye-catching labels and warning stickers on storage bins, storing medications in non-adjacent areas, and advising patients to remain alert for potential mix-up with look-alike, sound-alike medications. My current clinical facility site is Loomis House in Holyoke. One of the biggest responsibilities of the nurses is medication administration. My reference at the facility is Eric, who is one of the pool nurses. To prevent medication errors due to look-alike, sound-alike meds, Eric states that he uses his knowledge on medication brand and generic names, making sure that he understands what the medication is used for prior to administration. He also follows the 6 rights of medication administration, which includes the right drug, the right dose, the right patient, the right route, the right time, and the right documentation. There are policies and procedures in place at Loomis House in the event that a medication error does occur, but nothing regarding the steps to take prior. Technology and suggested improvements. At Loomis House in Holyoke, they have computer systems to obtain medication information regarding each resident and also for documentation. The system uses is called IMAR. The medication blister packs and bottles are stored in medication carts. Hospital facilities often use computer-controlled dispensing systems in combination with their other devices such as scanners to identify the patient and the medication. Advanced technology would definitely be a benefit to Loomis House and improve the safety of residents and reduce the number of incidences related to medication errors. Regulatory agency requirements. The Department of Health conducts audits annually at the nursing home facilities to ensure healthcare safety and quality. These reports are made available to the public on mass.gov for individuals to review. Any errors found during these audits jeopardize facilities and their ability to remain open. Corrections are made by the facilities if needed to be in compliance with the Department of Health. Conclusion. In my opinion, the strategies implemented by the nurses at Loomis House are effective in the prevention of errors due to look-alike, sound-alike drugs. The education received in nursing school will guide you throughout your nursing career providing standards and guidelines for patient safety. I believe there should be policies and procedures in place guiding the nurses in avoiding medication errors, not only after the error has occurred. This information should be provided in the policy and procedure book as well at Loomis, House, and Holyoke.